another misunderstanding is we call it the dry cleaner model, that my kid is anxious, or even they sometimes think about suicide, and we're going to drop the kid off at the clinic and pick them up later and they'll be well. That is the hugest and most destructive myth out there.
Hello, I'm Delaney Ruston, primary care physician, creator with Lisa Tabb of the 4 Screenagers movies, and this is Parenting in the Screen Age, a podcast about discovering the best ways to help our youth and ourselves navigate our rapidly changing digital world. And yes, we recently changed our name from the Screenagers podcast to Parenting in the Screen Age. It's May, which is Mental Health Awareness Month. Our previous episode this month was with researcher Jean Twenge and was about teen mental health in the context of social media, video games, and screen time in general. Today we're delving into a really important and often under-discussed topic, which is the role of counseling and therapy for addressing mental health problems in teens. Sometimes it can be hard to know when to seek out therapy, or how much parents should be involved in the therapy, and what is effective therapy. My guest today is Laura Kastner, a leading psychology and family therapist. She's been a therapist to teens and families for over 30 years and is the author of some of my favorite all-time parenting books, such as Getting to Calm and Wise-Minded Parenting. Laura is someone I often turn to when I need input regarding my own mental health, or someone in my family or close friends, and I'm so excited to have her on the show today, which is not her first time on the show. Before I talk with Laura, I want to share a clip from Screenagers' next chapter, the second of the 4 Screenagers movies, which is about addressing mental health of teens in the digital age. This scene involves my daughter Tessa, who at the time had been facing depression. As I was working on the rough cut of the film, Tessa got to see other teens sharing their story and realized how much that had helped her, and so she decided she wanted to be a part of the film. One of the things that very much helped Tessa was a certain therapist she had. Tessa and the therapist allowed there to be a little filming during their sessions together, and one of these times was with me in the session to learn how to best support Tessa. And I'll be the first to admit, even though I'm a primary care doctor and help a lot of teens and adults with depression and other mental health problems, it was a completely different matter when it was my own daughter struggling. I really needed help, and being able to be in family therapy at times was crucial, super helpful. The clip starts with my voiceover in the film.
I definitely need help in how to support Tessa better, to validate her more, and to not keep problem solving so much. So sometimes I join part of her therapy.
And then you see the therapist talking to me and Tessa.
I think for you, Delaney, you've really been working on understanding that you guys cope with stress in a different way, right? So the pressure really comes not so much from you wanting to help Tessa, but really learning more about how to help her, what works best for her, right? So what might work for you may not be the thing that works best for her. You are helping mom to learn that by communicating it. Like, that's not helping, or I don't need that right now, or if you could just do this.
You see in that little moment how the therapist helped guide us. So let's now turn to Laura Kastner and dive into the topic of therapy. What I love about our conversation is that having these nuggets of understanding about therapy and counseling helps all of us support others that much more. My first question to Laura was around how can we as parents know when to pursue therapy for our teens?
When should parents consider seeking professional counseling for a teen who's showing signs of depression or anxiety, emotional struggles, or they're not doing well in school? Sometimes it's really hard for parents just to have a sense of when it can be helpful. Do you have advice around that?
Well, you made it easy, Delaney, because when you said they have concerns about any of those things, why not get a consultant? When we have concerns about our plumbing or our electrical or our finances, we get a consultant. I don't know anything about plumbing or electrical, or I'm terrible understanding what escrow means. I still don't know what that means. So we get an expert, right? We get somebody that's hired to be an expert in the field. I know I'm being a little glib because trust in the competence of the practitioner is really important. But I would say, in answer to your question, if parents have reasonable concerns about depression, anxiety, failing to thrive at school, socially overuse of tech, get a consultant.
Mhm. And that could start with the school counselor, right? Because part of the immediate thing any listener will be like, it's so hard to find someone, et cetera, which it is. We appreciate that it is hard. What is your experience with the school counselors as one starting point?
Well, the ideal use of a school counselor is when there's a problem at school. They are absolutely the only way to go when when there's school refusal, a lot of absenteeism, school failure, difficulties with a teacher, with a class. Go soon. Sometimes I tell when I'm talking to younger parents of elementary school, I say, the first time you have a concern, please go to the school. They want a school partnership on these issues, especially absenteeism. And when a child even says, I hate school, I think that is a very serious thing. Go to school. We need it to be a place that they love to learn, that they feel secure. Children cannot learn when they're feeling off emotionally and socially. So see if there's a school counselor. They'll even see the family.
Okay, so let's get to therapy then. Let's take a 17-year-old. So he's a junior in high school and he's just getting by in school. He has C grades, not many friends. He doesn't really have any out of school activities. He's gaming in his room hours a day after school. He clearly needs a fuller life. And if you were seeing him in your clinic and the parents, and clearly some sort of rules need to be changed related to getting his life to be fuller, what are some things that you talk about in that session with all of them together, just to give us some kind of idea of how you would start thinking about how to change that situation?
Okay, a couple of qualifiers first. If all that was in the problem list were C grades, too much gaming, not enough in person time for the family or even for friends, I'd call this languishing. These kids are not flunking. He doesn't have a diagnosis of depression, anxiety, substance abuse, or anything, but he's certainly not thriving. When you have this kind of family come, it's a little harder than when it's clinical, ironically, because there is no diagnosis. It's languishing. On the other hand, who wants to have a kid that's sliding into the clinical? So, don't you want to prevent downward slide? Of course you do. But this kind of situation, you want to even be more gentle about pulling back and seeing it from everybody's perspective. We already can appreciate, Delaney, how it would feel for the parents having a languishing, moving to very low functioning kind of stuff. So, we'd want to sort of move back and understand it from the teenager's point of view. How does he feel about it? Right? Like, how does he like his life? What does he like about gaming? What kind of community of friends does he have in gaming? What does school feel like? If he doesn't like school, he doesn't feel like he belongs there, he's not in clubs, he's not in sports that would take up time to compete with the languishing gaming, overuse. I want to know, when did that start, that he didn't have friends at school, or he didn't have clubs or sports or after school activities or a job or volunteering, all the vital youth engagement that makes kids healthy. If he doesn't have it, when did that start? He's 17. And sometimes this starts in sixth grade when they start with the I don't wanna, and parents cave to that, not knowing where it's going to go. Okay. So if he's had sixth, seventh, eighth, ninth, 10th, and he's now in 11th, we're in our sixth year of I don't wanna non engagement. So this is a problem, but I'm not just coming here barnstorming saying, okay, you need to start engaging. Maybe he's socially anxious. Maybe he feels like a loser. Maybe he doesn't really have friends. And he's 6 years into this. Delaney, that is a lot of years of developmental vitality that this child has missed. So I'm going to be gentle about upturning everything in his life and expecting him to join two clubs and already have, in real life friends, right? So I'm going to go really big in terms of 10,000 feet up and understanding his life in the last 6 years first.
Let's talk about the value of doing that in front of the parents.
If you have them all three in the room, you always want to just stay with, okay, what's your perspective? What's your perspective? He says, I'm fine. You have the problem because you are going to try to overhaul his life and he likes it the way it is. Then you say, how is it when your parents want things to change up? How does that go? Is there a hardliner and a softie? What do you think your father thinks about this? Is it different than your mother? So I'm not going to put him on the hot seat. I'm going to have him just as much of a player in having perspectives and feelings that are very, very important as they have. So that's what I'm going to do with three people in the room, not just evaluate Johnny, right? Again, we've got 6 years to review, right? Middle school and high school. And how have they made policy changes before? Have they been fair-minded? Who's most unhappy about it? Are there other policies in the family that Johnny doesn't like and the parents don't like? So that he's not just pathologized as, the problem. Do not allow that. I want everybody to share this. If nobody's like thriving here, if they're that unhappy about Johnny, and maybe some of what they've tried and failed at in the last 6 years to get him more engaged in life. So I'm empathetic to everybody's point of view. I really care about those last 6 years of history, not to mention the 6 years before that, so that I can really get a sense of how this family functions in terms of making policies for his whole life.
Let's say we're further along, it's been a few sessions, and the family's doing a lot of work. He's doing work. You've been talking with all of them about limiting video games to pulling it back an hour a day, let's say.
By then, if he feels equally respected as the parents, what does he want to see changed about the family? And if they're going to take a sabbatical of half a day on Saturday, what does he want to do at that time? Is it with certain friends that he does like? Or maybe he can decide that, well, if you'll take me to a Sounders game, sure, I can take time off. So you're really trying to negotiate where it's worth it to him to pull off some of the gaming and get him engaged with what he can tolerate and what he might even like. I think if there was one theme, it's to understand that by the time parents are unhappy or worried about how a child or a teenager is functioning, it does put the child on the hot seat for, we're not happy with you. They can say, we don't judge, we love you, we just want you to do better. But there's a certain hot seat element to that where the kid is going to be defensive, if not hostile about that, and maybe even completely disagree with it if it has to do with, I don't need to do clubs and I can be at home and be online for 5 hours. It would be a disagreement. But once you make it like, you live with your family 100 hours and you're just with me for 1 hour, and everybody wants to be happier in this family. And how do we do that? The key is to have the parents not only own part of the solutions because they live with them, but be open to overall family changes and how they make decisions and how they treat one another, enhancing the love and fun quotient so that the unhappy pills go down of less tech or whatever it is. But, I have a real family perspective on this, that sometimes we're putting the child in the crosshairs of everybody's eyeball and examination. And it works better if everybody says, let's just look at what we can do to improve everybody's life in the family. We're all here to do the same thing, be happier together.
Before we dive back in, I wanted to let you know about our 4 Screenagers documentaries, which focus on helping kids and teens navigate the challenges of this digital age. We created these films to be screened in schools and at community events. Over 20,000 hosts have shown them thus far. Along with the movies, we provide discussion guides, promotional materials, and other tools so that you can easily organize a truly impactful event for your community. And if your school wants to use the movies in the classroom, we have options for that too, along with a full curriculum of lesson plans designed for various grade levels. To learn more about the movies or inquire about becoming a host, visit screenagersmovie.com. There's a link in the show notes. Now back to the show.
How has therapy for adolescents evolved over the years? Like in the past, there's kind of this myth, and it's similar for adults too, that a therapist is there to just listen and reflect back what the teen is saying. How has it traditionally been?
So when you said myth, the hugest myth, this is a misunderstanding of what it is on some level. But another misunderstanding is we call it the dry cleaner model, that my kid is anxious, or even they sometimes think about suicide, and we're going to drop the kid off at the clinic and pick them up later and they'll be well. That is the hugest and most destructive myth out there. This child lives with you. The family is suffering if the child is suffering. Nobody gets a playbook for how to manage a child who's depressed and avoiding school or has some suicidal thinking. No one knows how to handle that in a family. Even if it were a practitioner, they'd want to get a fresh pair of eyes, just like it would be for a heart attack, right? You don't treat your own child. So part of that is, oh, if Johnny is suffering or if Janie's suffering, then we all need to learn what is the best way to manage that at home, not just to mention what they learn in an hour of therapy with us that might be about anxiety, and anxiety leads to avoidance, and then they don't want to do things. And so we need the whole family to understand, how can we nudge this child to face hard things and challenges and not have the reduced life that they're going to have if they avoid everything that makes them anxious. That's a family challenge that they need curriculum on as much and sometimes more than the child.
More after this break.
Let's talk about what's happening with a teen in the clinic with a practitioner, let's say it's depression, depressive thinking. What makes your hair raise on your arms when you hear that a certain way that a therapist has been meeting weekly for ongoing weeks with that particular teen that you think tends to not be effective?
Depression, sadness, withdrawal, distorted and extreme negative thinking, life isn't worth living, or I'm bad at everything. Very extreme thoughts, magnification, generalizing of negative thinking, glasses half empty, and that's all you see. It's just this dark cave of withdrawal. Suicidal thinking being at one end. Cognitive behavioral therapy, dialectical behavior therapy, and even interpersonal therapy have been good therapies. So the therapist should be trained in those. But the thing that really, really raises my hackles is one or two things. The teenager says, no, I don't want them involved. And the practitioner listens to the child with depression brain decide what is in their interest and not in their interest. No, parents should always be involved. This is their baby. This is their precious child. And there are all sorts of things around withdrawal with a depression, which make a conundrum for the parents. They want to be empathic to their child who's depressed, but they don't want to follow direction of, okay, let's not do anything and let you stay home from school in your bed. One of the other effective therapies is called behavioral activation, which means doing more, not less. But that could be a conflict. The child wants to do less and hide out at home. And the parent says, no, let's have a walk. Let's go to a movie. Let's have somebody over. And the kid, no, 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 no. So it always involves the family when a child has an illness. Parents always need some guidance on what and what not to do. So what raises my hackles is that parents aren't involved.
Okay. So and the therapist goes along with that. So how does it look then when the family would be involved in, let's say it's a 14-year-old who's dealing with clinical depression? I know practitioners are different in this realm, but in an ideal world, the 14-year-old would possibly see that practitioner alone for some sessions, and then also have the family come in and do a session, and then back with the teen alone, and then back with the family, and sometimes to just meet with the family without the teen. But the teen would know that, with some understanding that most of the things that were discussed between the teen and the practitioner wouldn't be spoken to the parents unless it was relevant to them getting better.
The most important thing is how one begins your treatment, which is at the very beginning, it should be what I call a partial confidentiality, which means what's agreed to, and this is what's on my consent, is that parents are never, ever, ever eliminated from the picture. It's like you are being evaluated for an illness, right? And parents will be caring about what best to do with this difficulty. They need some guidance and some support on how to handle things that will come up related to your difficulty. So I am always going to keep them involved. It used to be the old-fashioned, I call this last century thinking, and I mean it, last century, that you'd say, I won't tell the parents anything unless you're going to hurt somebody else or hurt yourself or you're gravely disabled. That used to be the very, 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 very low bar. And now we say, if you have a difficulty, it involves everybody in your family. They may need guidance. I am accountable to them, so I have to account for myself and the treatment that you're getting to them. We will have an agreement of what I tell them and what I don't tell them. about some of the private things you tell me, and you're trusting me as your practitioner to make that judgment. You know, so if it was some family that was homophobic and very, very rigid and very, very dogmatic about something related to LGBT, I would keep that private, right? If it has to do with no, I prefer to keep them out. I want this to be private. I want to just talk to you about things. I would say it's a no-go. Absolutely not. Because I've seen scores and scores being around as long as I have. A lot of practitioners, where they go down is that original rigid last century thing of I won't tell your parents anything. Before you know it, they're using drugs. There are all these things that you're aware of, and you're not telling the parents about this. The parents need to be involved in how do we help them figure out some strategies of how to address or whatever's going on.
And we'll just take this off the table right now, which is that, of course, if there's been identified as an abusive parent, that's not what we're talking about.
If there's a situation of the practitioner learning about abuse or neglect, we have an easy way of doing that. We're so trained to move to calling CPS and we're legally obligated. That's easy, right? The hard part is if you've already had your hands tied by saying, I will keep everything private from your parents and we'll meet alone for the next 6 months while you might be getting even worse, but I'm not supposed to be involved with the parents. See, again, just I always say it's to everyone I train, I say, it's a math issue. They are with us for 1 hour. They might be depressed. They might need to be considered for a medication. They might need to really have some rigorous intervention around this. But if we've already left out the parents, we've left out all those hours of the child's life outside of that little hour that they have with you, where decisions need to be made to help enhance their mental health. None of that can occur if you just see the child alone.
How often are you seeing the teen alone and the parents alone versus the three of them together? Or what, two together if it's only one parent?
I always am involved with both. If a child has been or a teenager has been referred to me as the patient. Sometimes I do parent counseling without ever having met the child, but I will never do therapy with just the child and not have any contact with the parents. I really prefer the first session to be with everybody there and different perspectives. And then I always have alone sessions and parent sessions. And the first one with the parents, I say, okay, I got a lot out of that joint session, but now tell me, we're going to talk about a lot of things that you really don't want to talk about in front of the child. Like maybe I'll talk about their marriage issues or their employment issues or their financial problems or whatever else that might be bringing stress into the system that fuels the stress for the whole family. But I prefer joint sessions when I want to teach or guide certain goals, like let's have respectful conversations, civil discourse about how to make decisions, how to make policies, how to listen to some of the feelings that children have and teach validation skills. So that is definitely a family therapy agenda. Attachment-based family therapy, where we really work on relationships and listening and making sure the teenager feels heard. You know, as we always say, validation is an agreement and it isn't necessarily a pre-approval. It just means, oh, I see it from your perspective. So that's a lot of really good family therapy. However, sometimes it's really good to have separate parent sessions to deal with getting parents on the same page, the unity, the confidence in engineering some of their policies, but also to teach some of the validation that may be too hard to teach when the child is alone, and to support their boundary making that might be just like easier and more expedient to do with the parents alone.
What's a way that some counselors approach working with kids and teens that you have a problem with?
Sometimes, ironically, going in and repeating, nobody likes me. There's nothing for me at school. I hate my body. My friends are mean. There's a certain aspect to anxiety and depression that can be what we call rumination, which is just repeating this sort of merry-go-round of sorrows over and over. And we always say the neurons that fire together wire together. If you keep saying and thinking and feeling over and over negative thoughts, that is your reality. You're creating that reality. Rumination is one of the most self-destructive processes within anxiety and depression. And so going over and just letting that loop go, and with no evidence-based therapy, the ones I've mentioned, would be more harm than good.
Let's take an example of a teen who's in there and saying, I hate my body and no one likes me. What's an example of cognitive behavioral therapy that you would possibly employ?
Well, first I'd explain that those ruminating thoughts looped over and over can be very, very harmful and make depression worse. And in a nutshell, what cognitive therapy is writing down your automatic thoughts and then challenging those thoughts. And so part of the challenge is, what's the evidence that disputes that no one likes you at school? So you're thinking about how no one likes you at school, but is there any evidence to the contrary? Well, I do have Sally and Sarah in that class, or there are other experiences I have at school that aren't all bad. And then you'd say, what's a different way of looking at this? So we start to challenge their extreme thoughts that are really a part and parcel of a depression. Then there are other techniques we have called acceptance and commitment therapy that has to do with allowing those thoughts just to be thoughts that come and go and not to be sticky brain about them. So we have lots of techniques we can use for depression. And that's why we get training. You can use all sorts of techniques for paced respiration and slowing down your heart rate so that you are able to choose more accurate thoughts about the world around you. So, you might have these racing thoughts that are quite extreme and self-destructive, not just passing negative emotions, but extreme. Nobody likes me. Life isn't worth living. And getting your heart rate down, you can start to think more clearly. So whatever we call it, we might call it mindfulness. We globally call it emotional regulation. So you can get your heart rate down if you're really, really upset and distressed, whether it's depression or anxiety, making it likely that you can think more accurately. And then you can make choices about the 20 things that make me feel better, right? Like taking a walk, doing some art, playing some music, and so forth. Being able to slow down, be present in the present moment, and suspend judgment, because we have that inner critic that just keeps coming at us. So that's why that emotional regulation piece is so important as a nugget that we include in all of our therapies.
That was Dr. Laura Kastner. A huge thank you to Laura for sitting down to speak with me for this episode. Check out today's show notes to find out about Laura's wonderful books. If you want to hear other podcast episodes with Dr. Kastner, go to screenagersmovie.com and navigate to the podcast page. Episodes featuring Laura include managing meltdowns and easing sibling screen time conflicts, as well as talking to your teen about sex, advice for parents, and finally, parents in conflict over screen time. And let me remind listeners, you can go to screenagersmovie.com and see how you can bring one or all 4 of the films to your community to really spark collective action in a time when we're all looking for solutions. What a gift that you chose to tune into the show today. The Screenagers movement is all about doing this work together. Make sure to subscribe to the podcast to get each episode automatically. And the more subscribers, the easier it is for others to find us. And if you give it some stars, that helps even more. Check out screenagersmovie.com to get resources for each episode, to learn about our 4 Screenagers movies, and to find my weekly parenting blog, Tech Talk Tuesdays. Curious about a specific topic? Use the search bar to get answers from our many blogs and podcast episodes. Finally, I love hearing from you, so email me at delaney@screenagersmovie.com. What ideas do you have for future episodes? Today's show was produced by the following people: me, your host, Delaney Ruston, Lisa Tabb, Rebecca Tolan, and Robbie Carver.